Hello guys, you're welcome to my YouTube channel. If this is your first time here, please don't make it your last. Hit the subscribe button please. Today we'll be talking about the pros and cons of becoming a medical laboratory scientist, or as they also call it, the biomedical laboratory scientist. Yes, my name is Dr. Buchi. There are certain questions I get asked often, and one of them is different people asking if they can or should become or even choose the medical laboratory science as a career. And I tell them that their decisions are basically about them, as there are loads of things to consider, and these things will around their personalities and what they are basically open to. So today I'll be sharing some pros and cons that will help you decide if you will consider the medical laboratory science profession as a career. So whoever decides to go the medical laboratory science route should be ready to attend the medical laboratory program, of which the courses and internships will help prepare one for a job at the end of the program. Hence, the medical laboratory science is a highly professional field, and the basic things to consider are the roles of the medical laboratory professionals in the healthcare system. If this aligns to your careers and your career aspirations, then let's drive forward. The medical laboratory is vital in the healthcare for the diagnosis, detection, and treatment of diseases. So as a medical laboratory professional, your role and jobs will be to give and deliver to the physicians a clearer picture of what is going on in the body of the patient at a given time. And this is achieved by analyzing the patient's specimen and samples. So in your modules and courses during your program year, you will be taught how to analyze the patient sample through laboratory tests and how to be behind the scenes analyzing patients' bodily fluid such as urine, blood, and tissue samples. The laboratory test results help to diagnose and treat patients. The medical laboratory scientists, also called the medical technicians, medical technologists, clinical laboratory technologists, based on their different cadres and academic or educational exposure, work in the hospitals, diagnostic laboratories, schools, campuses, outpatients facilities, reference laboratories, research laboratories, etc. In much bigger organizations, it is a lot profound to specialize in options as well. For instance, the microbiology scientists, in some places, these are called the microbiology technologists. This set of people or scientists have the roles of examining and identifying bacteria and many other microorganisms. Now, the chemistry scientists or technologists, this set of scientists engage in the preparation of specimen, in the analysis of hormonal as well as chemical contents of body fluids. We've got the blood bank or immunohematology scientists or technologists. This set of scientists collect, analyze, classify, as well as prepare blood for transfusion. The cytotechnologists help to examine blood or body cells under the microscope to check for abnormalities such as cancer, etc. The immunology technologists, this group of scientists analyze samples that have to do with the human immune system and its responses to foreign bodies. Now, dealing with saliva, blood, mucus, feces, bone marrow, human tissues, etc., just name it. Someone in the laboratory is testing it. And for a handful of people, this might be a huge deal breaker. But the truth is that the role cannot be done without this specimen. and it really involves the risk of being exposed to pathogens or microbes from samples, even though the risk cuts across healthcare professionals. But you have to be working with directly rather with patient samples who might be having infections, and you could be exposed to infections if you do not take adequate precautions. You are exposed to fire hazards, chemical hazards, and literally a lot of things can actually go wrong in the laboratory. But trust me, you will be taught how to go about all the safety rules and precautions. So I am not trying to make you fidget or even discouraged already, but you need to ask yourself why you want to go into this career. Could it be because it was the easiest way to get into the medical field? Could it be the money, or to boost your personality, etc.? Do you know that a lot of people don't even know what you do in the laboratory? But remember, your job as a medical laboratory scientist would have a lot of impact on patient care. Now, let's talk about the program itself. Training and schooling. You'll be looking at spending about 5 to 6 years in school studying and getting trained to become a medical laboratory scientist. This is dependent on your choice, specialized career path. The big question is, do you have fun studying science? Do you understand the concepts of physiology, anatomy, and their likes? Do you love biology, chemistry, physics, etc.? Because the time you put in the study is so real, and this is a big commitment. The medical laboratory school will go in depth here. We go really, really in depth in the medical laboratory science. Are you ready to go in depth? You would learn about a lot of diseases to correlate the laboratory testing. You'll be left with questions about why things change or happen in the human body and the causes of these alterations. Your big question would or should also be if you are self-motivated, as you would be left to motivate yourself a lot of times. Are you a problem-solving individual? Can you figure out answers to your questions a couple of times using pieces of information gathered from different areas? Are you a detailed person or a research-oriented individual who can work efficiently and effectively on your own? These questions, this quality prepares you for the job of a medical laboratory scientist. Are you ready to do night shifts or calls, as some people call it calls? As some people would call it. These shifts or calls will be about 8 hours, 9 hours, or even more, as the case may be. And this is dependent on the facility. But just understand that this is healthcare, and it has to run round the clock, and someone must be there to cover a shift to just keep these facilities going. In the laboratory, accuracy is very essential in the testing, the results, and even in the documentations. You know that the objective is to draft out how to eliminate factors that can impact the result quality. I believe that people do better in what they enjoy learning. So if you enjoy learning all of this, then you could consider the study or remain in the study or training of the medical laboratory science. Now, let's talk about the pros and cons of being a medical laboratory scientist proper. Number 1, advancement opportunity. Number 2, plenty of job opportunities. There are loads of job opportunities in the medical laboratory route or field. Number 3, it is a field that has good job growth. In medical laboratory science, there are opportunities to grow on the job. Number 4, specialization options. In here, we have different specialization options in the medical laboratory practice. We have the hematology, we have the medical microbiology, the chemical pathology, the histopathology. Now, number 5, there is good salary. Scientists receive a fair salary, kind of. Number 6, opportunity to help others. As you run analysis and tests, you are also taking part in contributing your quota to the patient and ensuring good results. Number 7, diversity of task and good level of education. There is no way you can remain or become a medical laboratory scientist without undergoing a good level of education. Number 8, opportunity to train younger professionals in the field. Now, here are the cons of being a medical laboratory scientist. Just as we have advantages, we also have disadvantages. One of the disadvantages is that, one, you would experience long work hours. Yes, this is so real. You will experience long work hours occasionally though. Number 2, you will be exposed to fumes from certain chemicals, and this is very true. Number 3, the medical laboratory science profession is a high pressure profession. You must have to be under pressure a couple of times just to deliver results, good results I mean. Number 4, it is a field that is difficult to break into. Without preparation, without success, without achievement, you cannot break into the medical laboratory science. Number 5, lack of recognition. In here, in the medical laboratory field, as a medical laboratory scientist, you might likely not get the kind of recognition and attention or respect that you want, which could be between you and top management. And besides, you will work behind the scenes. So if this video has helped you, please like, share, make comments, as we'll be looking forward to more insightful videos often. Thank you for staying tuned to the end. All right, people, I'll see you some other time with another beautiful topic. Until then, stay true to yourself, stay safe, love yourself generously. For now, bye.